Welcome back to Famhealth. As you know, September 29th is World Heart Day across the globe. And the theme for World Heart Day this year is how to use your heart to beat cardiovascular disease, and also how to use your heart in order to make perfect choices to prevent cardiovascular disease. Today, we have with us Dr. A.B. Mehta, who is the Director of Cardiology at Just Lok Hospital, but is also a cardio god in his own right, and it's the first name we think of when we think of interventional cardiology. Thank you so much, sir, for joining us today. And we just want to know, before we ask you any questions, do you have any messages on World Heart Day that you would like to give out to our viewers?
To take care of your heart is a responsibility to you. Not only that, but to the society and to your family. Your heart is not inexpensive, it's not cheap. Your heart is a very valuable organ, and it's such a faithful organ that it starts beating before your birth and does not stop till you breathe last. So for God's sake, please be kind to your heart.
Thank you, sir. And so kind of connected to that, one of the themes this year is how to make better choices in order to prevent the risk factors for heart disease in the first place. So what are some better choices that our viewers can make, or that you would recommend Indian people who seem to be genetically more predisposed to cardiovascular disease can make, or precautions that we can take?
Well, I think before I answer your question in detail, I'll run you through the natural history of heart. You know, your heart is such a powerful organ that if you collect all the energy the heart spends throughout one lifetime, you can lift up the heaviest battleship above the ground 5 feet. Your heart pumps the circulation, and if you put all arteries and veins in one line, it will take a full circle around the globe at the equatorial level. So you can imagine it beats 2 to 3 billion times for a 60 to 70-year-old man entire lifetime. So it's such an ingenious pump that has never been duplicated by anybody. Only God can make it, and only God will continue to make it. All right. Now, you know, the care of the heart disease, it is wrongly thought that I should take care of my heart after the age of 45 or 50. That's not true. Let me give you a few examples. It was a shocker to me. I got a patient who's only a 16-year-old school-going boy, and he said while he was cycling, Sanjana, that he was cycling to go to his school, and in the middle of the road, he would stop cycling because it would hurt him in the chest. And one day, 2 days, people poo-pooed him. People started joking about him, but he insisted he came to, and he had 5 arteries blocked. 16-year-old,
wow, that's
5 arteries blocked. And and the care of the heart disease starts from the early days, like from your school going. When I was in Chicago, I was in a research project, and we found 14% of the children, school-going boys and girls, had high cholesterol levels. And now you can imagine at that age, in their teens, their high cholesterol level. Should we not be knowing that long before, till we come to know at the age of 50? How can we ignore such a thing? And all right, give you one example more. When the autopsies were done on those Vietnam American soldiers, they found sizable number of them, when their coronary arteries, they were blocked. So those young soldiers, youngsters, with not above the age of 30 for sure, and that is the way it is. So therefore, just as we say that I'll take care. No, nothing like taking care. It should be way of life. So, like just as you take a bath, where you brush your teeth, is your way of life. You dress yourself is a way of life. So eating right food, behaving rightly, keeping right temper, exercising regularly is a way of life, period. That's the way it should be. All right. Now, let me come back to your question. I would say use your heart to take care of your heart. No, use your mind, your mindset. You use your mind to take good care of your heart, and the heart care will be automatic. And you know something, no matter what you do, the animal will starve. Tiger will never eat grass. An elephant, no matter what you do, will not eat meat, because that's the way of life. It is impregnated in the mind, in the physical status, in the physic, whatever you want to say. But we human beings keep on violating the rules of the nature. That I think is wrong. That's a way. I think just I I I do not want to take care of my heart as a project. It is just built-in behavior. It is built-in way of life.
Yeah. I mean, it definitely should be. And I'm really shocked to hear so much about, young people with incidences of, heart problems or high cholesterol. So I'm wondering now if that is the case, and if you believe that there are so many young people that also struggle with this, what can we do as, like, should we start getting tested at an earlier age in order to detect it early on, and then, start making amendments to our life early on? Or what would you recommend? And if so, what kind of tests should we be getting?
Education. It's an education. I think the education will start in schools, and then it will be what should I say, continued medical education program. Like say, for example, in Japan, incidence of heart disease was quite low till the Pizza Hut went there, and the McDonald's went there, and Kentucky Fried Chicken. When they all went there, the incidence of heart disease started rising, and they started coming closer to United States incidence and all. So you see, the education that should be throughout the life. And I also think, now years ago, you remember that there was no ban on cigarette smoking advertisement, and then in small minuscule writings they would say it is injurious to your health.
Yeah.
And I think who are fooling whom, God only knows. And therefore the education, administration, support by the health ministry, the healthcare workers, and all those things will put together, will send a message, a firm message across the minds of the people, that this I should ever not do, and this I should always do. This is what it is. And by and large, there are two things which are, or let me say, there are some risk factors which I can control well. It's in my hand, but there are some which is beyond. Say, for example, family history. How am I going to choose my parents? I can't. So therefore, that is a totally untreatable, unavoidable factor. But nevertheless, in that situation, I should be a little more careful, little extra careful, and make sure that I stay within the pre-specified parameters. That I think would be essential. And there are certain treatable factors. For example, cigarette smoking. Now, any animal smokes? Never. And therefore, smoking is a taboo, a big taboo. And then why have you got to acquire it? When it is, nobody has ever told me that smoking is nutritious, it promotes health and all. On the contrary, everywhere. So the education, I must come back, that education is very, very important, and continued education, so that any new item comes, maybe our parents never ate pizza, they were not there only, who knows? But those new things, when it come, do not adopt very easily. You heard of potato couch syndrome? What is happening is that our youngsters, the boys and girls, they sit on the couch and keep on munching potato chips and whatnot, and watching TV. Do you know, Sindha, today's boys and girls are spending more than 2 hours a day in front of a fluorescent screen, be it computer, be it a mobile phone, be it video games or TV. That's just pathetic. They should be in the football ground. They should not be locking themselves into in the bedroom and then watching movies and whatnot. No, 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 no. It's humbug. That never should be promoted. That's where the parental guidance, education comes in.
Okay, so we just talked about, the incidence of cholesterol and potential heart disease in young people. So for me personally, just recently, my fiance had his blood work done, and he has really high cholesterol actually. So, on a personal level, but also, of course, for all the viewers that are watching, what is something we can do, or what should I do now? How do I help him manage his lifestyle? What kind of changes should he be looking to make?
Okay, very good. As we were discussing the preventable risk factors and non-preventable risk factors, cholesterol is partially reversible by modification of diet, but in many situations, it should be supported with medications also. Now, I for one believe that for asymptomatic individuals should have an LDL cholesterol below 100. And those who have already developed heart problem, we call it as secondary prevention. The opportunity of primary prevention is gone because they developed the heart attack already. So in those individuals, our cholesterol level, we will be aiming to keep it below 70. Now, that sometimes, so therefore, exercise raises good quality cholesterol. There are two kinds of cholesterol, good cholesterol and the bad cholesterol. Exercise helps to increase good cholesterol, but somehow let me be very frank with you, Sanjana, we cannot influence good cholesterol very much, either by medication or by exercise, but marginally, to beat whatever it may be. Let's try. Bad cholesterol is a brick over which the plaque is built. Plaque is nothing but some sort of a material, fixed material on the inner lining of the artery. And when its volume keeps on enlarging, the lumen starts becoming narrow, and someday it closes completely, resulting into a heart attack. That's apart. You asked me a question that how should you take care of cholesterol? The diet. Now, for example, trans fats, that is hydrogenated oils. So there, chemically what we call it is the valency is fully saturated in those kinds of fatty acids, and they are very harmful. So we used to have from Hindustan liver, dalda, and all those kinds of hydrogenated trans fats. They should be strictly avoided. What about cooking oil? What about ghee? A lot of controversies you keep on reading in the papers and the media that ghee is good, ghee is bad, etc. In moderation, as long as it is your status of cholesterol in your blood checked periodically stays within the specified parameters, I'm okay with it. And the cooking medium, polyunsaturated fats and monounsaturated fats used in sequence is good enough. Some oils are very expensive. You don't have to go for that. But I would say corn oil, maize oil, teal oil, they all are sunflower oil. They all are good. And cooking medium, you can liberally use them. And I would say that your diet is your customary culinary. And so it's very difficult to change. But try and make sure that even I'm not saying you can go on an eating binge just once in a while, but it's a life after all. So that's okay. But by and large, generally make sure that periodically checked cholesterol parameters in your blood stay within the acceptable limits.
And if you are outside of the acceptable limits, you think it's mostly a function of diet?
And at times, because your liver might be lacking in certain enzymes to metabolize and sequestrate cholesterol. In that situation, it should be supported by medications. And we have found that keeping cholesterol within the specified margins helps a lot in postponement of coronary disease.
Definitely.
I'm sure you all know that you can never overfeed a child. You give an extra, mother sometimes wants to give some extra, little more milk, he'll throw it out. He will not accept it. Similarly, you eat to live. You don't live to eat. Therefore, you eat as much as you are hungry. Many times, my wife compels me, no, why do you want to waste food? थोड़ा ले लो, थोड़ा और ले लो. ये खराब हो जाएगा, फेंकना पड़ेगा, अच्छा लगता है क्या? But the food wasted outside the body is better than the food wasted inside the body. So I tell her that way. So, as you said, they eat when you have to, eat on time, eat the right proportion. Calories, your intake is more than your expenditure, that your energies, your spending, and like exercises, your lifestyle is, say, sedentary lifestyle, and your eating habits are still what you were in the college and all, you start gaining weight. Avoid all those things.